Hello and Assalamu alaikum. Ultrascan Diagnostics. This is the CBCT of the patient that you had requested. The area of interest is the lower left 6 and 7 and the 8 for evaluation for extraction. Now starting with the lower left 6, let's go on the axial view. We can definitely confirm that the lower left 6 definitely has a crack. You can see that here it's underneath the crown, even though the root canal is done very well. But since we have a post, this radiolucency is indicated that there might be a fiber post in this region. We can clearly see that there is a fracture line in the mesial root, and this fracture line is extending below, and we can see a radiolucency and a line in the mesiobuccal canal specifically. Now, this is indicative of the radiolucency, and this is something that happens when too much pressure is applied during the post cementation or due to a long standing post. So, there definitely is a vertical root fracture. When we move towards the lower left 7, we also see a line here and a radiolucency here. On the transaxial view, even though the root canal procedure is done really well, you can see it here. Perfect obturation with a slight radio opaque material extruding out of the apex, but we can see that there is a radiolucency associated in the furcation area and the mesial root, and you can see that there is a crack line extending here as well. So 6 we can definitely confirm is cracked. This is the 7. The 7 also shows a radiolucency. The crack line that we've shown isn't 100% confirmed, but definitely shows that it could show signs of cracks. Moving to the lower left 8 on the endo mode, you can see the lower left 8 is approximately, there you go, 3 millimeters away from the inferior alveolar nerve, and at its closest point, close to the distal apex, we're approximately 1.2 millimeters. We're not compressing the inferior alveolar nerve, but it's definitely very intimately and closely associated. And at one point, it comes to zero point 0.7 millimeters close to the inferior alveolar nerve. Now this is the full mouth x-ray. Here you can see the lower left 8 is very closely associated with the inferior alveolar nerve. On this view, you'll be able to see that the inferior alveolar nerve is definitely very close to the wisdom tooth. There is a very deep lingual fossa that needs to also be evaluated, but here you can see at its closest point, we are approximately 1.7 millimeters close to the inferior alveolar nerve. As you move distally, we see that we come to 0.7 millimeters close here as well. So definitely confirms what we saw in the endo mode. And as far as the 6 and 7 are concerned, there definitely is a radiolucency. Even though this is on this view also, you'll be able to appreciate that there is a radiolucency and a crack developing. In the 6 and 7 shows some sign of crack and needs to be clinically evaluated.